If your luxury skincare hasn't worked, it's not you, it's either the wrong products or the wrong plan. In this masterclass, Why Luxury Skincare Fails, I'm going to discuss the strategy I use with my one-to-one clients to create real transformation. Most of our clients arrive to us disappointed and confused as to why they're investing in premium skincare, some of them spending hundreds of pounds, but they don't see a visible result. There's a reason why, and it becomes clear during our consultations that it's just down to a lack of understanding as to why and how skincare works. I always explain to clients that there's three types of skincare, that all skincare will fall into these categories. There's cosmetic skincare, there's cosmeceutical skincare, and then there's medical grade. And depending on which category it falls into, for example, if you're using cosmetic skincare, it's only going to sit on the surface of the skin. Cosmeceutical skincare is going to penetrate into the upper layers of the epidermis, which is where our skin cells are. And then when it comes to medical grade skincare, that has the ability to penetrate all the way down to the dermis. And that's where we are able to see a real visible change in skin conditions like acne, rosacea, pigmentation, anything like this, where we're experiencing collagen degradation and we're wanting to plump and firm the skin. It's only going to be specific medical grade skincare that is able to correct these types of skin conditions. So this is where it comes down to, if clients are coming in to see us and they're using Elemis or some of these other really nice premium skincare brands that are designed just to sit on the surface of the skin, they're obviously not going to see a visible change in the skin. The change that they sometimes can see is that their skin will start to feel softer and smoother. But again, this is like just putting a layer of product on the surface. This smoothness or hydration is actually superficial, because once you've removed it with a cleanser, your skin's actually dry underneath, because that product hasn't been able to penetrate in and actually provide moisture into the skin. So the types of skincare which we've just briefly discussed. So this is an example of young and mature skin. Obviously you can see with the mature skin there, we've got some deeper wrinkles. And this is basically what happens as we're aging. Obviously we're going to go from having nice, taut, plump, firm, bouncy skin to and you can see here the reason why this is going to sink, because we've lost the structure. This is the supporting structure of our skin. So in the young skin, you can see you've got your collagen, elastin, hyaluronic acid. These are collagen fibers. They're little green balls. They're representing the hyaluronic acid, which is the water content of our skin. And then where we've got these red areas here, little red area that's kind of holding these bands of elastin fibers together. These are actually called fibroblast cells, and these are the cells that are responsible for providing this dermal layer of the skin, because they provide collagen, elastin, hyaluronic acid, which is the skin's supporting structure. So as we get older, the fibroblast cells start to decline in how they perform their tasks, which is to produce collagen, elastin, hyaluronic acid. They're obviously going to produce less and less and less, and depending on what's causing them to produce less, obviously there will be the fact that we're aging, which does have it slows everything down. But essentially, the main reason for the collagen loss and the damage to these cells is due to external UVA and UVB rays, which are obviously present in the daylight and the sun. So it's normally 80% of the damage here is actually caused by the sun or the UV rays penetrating through and basically breaking down the collagen. So cosmetic skincare, that is going to be the majority of skincare, which basically sits on the surface of the skin. We've got cosmeceutical skincare. This is formulated to penetrate through the skin's waterproof protective barrier and deliver some ingredients into the top layer of the skin. But obviously you can see from here, if we're just treating the skin with cosmeceutical skincare and we have got issues with collagen degradation, we're going to want to be encouraging these fibroblast cells or stimulating them to reproduce or produce more collagen and elastin and hyaluronic acid, the skincare, if it's cosmeceutical, doesn't actually penetrate that deep. So that is unable to have that effect on the skin. So that's why we use medical grade skincare, because it can penetrate down here into the fibroblast cells and obviously stimulate these to then plump up and revolumize the skin. So one of the reasons our luxury skincare fails is because it is cosmetic, it's a cosmetic formulation, or it might be a cosmeceutical formulation. And again, like we've just said, you're not going to really see a significant improvement or difference in the quality of your skin if you're using these two types. So that would be the first reason as to why the skincare fails. And the second reason would be, if you are using the right skincare and it's medical grade, you might not be applying it in the correct way, because like I said before, our skin is not designed to let anything inside. So it is designed to keep everything out, including our skincare. So if we are using medical grade skincare and we're not seeing the results that we expect to see, say for example, if we're trying to treat pigmentation and we're not seeing the pigmentation fading, or we are treating acne and we're not seeing an improvement in the acne, it's not clearing, it's not looking brighter and healthier, or we're using it to treat aging and we can't really see a considerable difference in that. So it's not plumping up, our fine lines and wrinkles aren't being plumped up, for example, then it is more than likely because of how it's applied. So this is why when we prescribe medical grade skincare, we actually educate our clients in how they use it, and we give them step-by-step instructions, an AM and PM routine, because if they're applying a vitamin C and they're applying a retinol, which these are all high quality ingredients that we're going to include in their skincare plan, because these are going to have a significant benefit to the skin in that they're able to stimulate our collagen, elastin and hyaluronic acid in the dermis. So, but if we're applying those in the incorrect way, for example, if we're applying a vitamin C at night and then going straight on with our retinol, it's not going to work. So the retinol be impaired, it's not going to be able to do its job, it's not going to be able to reach the dermis, and it won't be able to then stimulate the fibroblast cells. The other thing that matters is the molecular size. So sometimes products will have to be applied after they've cleansed, toned. Say for example, if we're applying a specific serum, we may have to cleanse, tone, or cleanse, polish our skin, tone the skin, and then apply, say, like the fourth product, which might be a niacinamide serum, for example, which is going to help. It helps with pigmentation, but also it's anti-inflammatory as well. So it's going to nourish, hydrate, have a mild impact on pigmentation. So it's always going to fade pigmentation, basically. And if we then apply that in the incorrect order, so if we put a cream on before we apply that particular product, the product that we're using to, the niacinamide product isn't going to work the order in which it's been applied. The other thing that determines how successful these ingredients are at doing the job that they're supposed to do is the pH as well. So sometimes the toners will adjust the pH of our skin, and that they do that so that the products that we apply after are able to penetrate in, because the high pH means that we're going to get less penetration into the skin. A lower pH is going to allow those ingredients in and they will go deeper. So all of these things matter. We don't want to make it complicated for you. We don't actually. What we do is just explain to clients, this is how you apply this product. You would cleanse, polish, tone, apply your serum, apply, like a targeted product, and then we'd say you'd apply your SPF after. So we kind of make it as simple as possible for people, but we know if they're following that plan correctly, then they are going to see wonderful results. And we see this because we have clients that come in and follow our plan, and we have other people that come in and use other types of medical skincare, and they don't have amazing flawless skin. They probably still have, some of them still have pigmentation. You can see that they're not actually volumizing their skin, and that will be that they're just using these products incorrectly. So next, we've just got some before and after results of this client in particular on the right. Actually came to me, she'd purchased a skincare set from Medicate and wasn't actually seeing any results. It was actually creating a bit of sensitivity and irritating her skin even more, making it even more red. But again, with rosacea, it's a little bit complicated. So we don't introduce actives when clients are sensitive, red, rosacea. We put her on a skincare plan and gave her, I think it was 3 products initially to use for a couple of weeks to reduce the redness and calm the inflammation, and to basically just calm and start to nourish and feed her skin. And then once it was becoming repaired, it was then able to tolerate more active ingredients, which you can see on the right hand side there. This was after a couple of peel treatments. So she'd used her skincare at home, came in to see us for about, or used her skincare for about 3 or 4 weeks, came in to see us for her first treatment. She'd already been able to reduce a lot of the redness and inflammation. We then started to provide some peel treatments, and at that point we gave her some additional actives that she could use to create healthier, younger looking skin. And she did actually notice within 6 to 8 weeks after that, she'd got areas of pigmentation which had been reduced. And then this image on the right is actually my skin before I started using medical grade skincare. I was actually using some cosmeceutical skincare before I went on to medical grade. But again, because the skincare was, I'll just go back to this slide, was penetrating into the skin cells, but still in the layers of the epidermis. And further down here would have been our hair follicle, which we can't see on this diagram. And we've got oil production, our sebaceous glands, which are, inside the hair follicle. And it's these actually, the oil production that causes a problem when in acne. So because I was using cosmeceutical skincare, which couldn't quite go deep enough to reach the area that needed targeting, which was the oil production within the follicle, I wasn't as successful using cosmeceutical skincare to treat the spots that I was getting. These areas here where it's a little bit darker and red, this is just post-inflammatory hyperpigmentation, which happens. A spot equals inflammation, and a little bit like this is inflammation from rosacea. Mine was actually inflammation from spots, and that created darker and red patches. So the darker patches are pigment due to inflammation, and the red patches are just red areas where the inflammation is just a little bit more vascular. So it wasn't until I started using medical grade skincare that my skin became completely balanced and healthy in its function. So I managed to remove all of the pigmentation. I do no longer get any spots. I don't have any inflammation. Everything is healthy and functioning well. And at the same time, fortunately, whilst we are treating these skin conditions, we're also introduced vitamin A, which stimulates the fibroblast cells. So we benefit from obviously correcting these skin conditions, but also we're getting a really potent anti-aging benefit. So our skin is becoming volumized, our fibroblast cells are working a lot quicker and, at a higher capacity. And then that gives us healthier, younger looking skin, basically. So we've got another client here. So this one was actually, this is a bit back to front really, because she was actually using about 3 or 4 essential skincare products. So wasn't actually following a full plan. She wanted to invest in some anti-aging treatments as she was approaching 40. We gave her a couple of really nice skincare, like I say, essential skincare products to use. And she was having regular microneedling treatments, but then was invited to try some products from Skin and Me that she was using and going to then promote on her social media. So she was on our skincare and having regular facials, and then we didn't see her for a couple of months. She came in for a microneedling treatment and we realised that her skin had really deteriorated. And when we found out, wanted to obviously see what had happened, it was because she was following this plan from Skin and Me. So whilst she was using medical grade skincare, she would have been using ingredients like vitamin C, vitamin A. She would have been exfoliating regularly and just following our method basically. But after she'd run out of our product and she moved herself onto the Skin and Me plan, it did include some high strength vitamin A, which was tretinoin. She was using tretinoin with us, but she was using some alpha hydroxy acids and some tretinoin as part of this plan, but we can clearly see that it wasn't working because the skin had deteriorated, the texture had become more coarse, the skin wasn't radiant and healthy and nourished anymore, and the tretinoin I don't believe was working because her skin should have either maintained where she was rather than deteriorated, so something had gone wrong there. I think this was in August this year, and anyway, she's using our products again. I think she's using about 4 or 5 using the Zeo Skin Health, whereas she was using a Abaji Medical before. And even within the first 6 weeks, she said she'd seen a huge change in her skin, and she's actually not wearing makeup anymore, she told me recently, so that's wonderful. And she's going to stick to obviously her daily skincare routine now, and she's still having a regular microneedling facials, which she has every 8 weeks. On this slide here, we've got a couple of really lovely clients. We have our client who was going into Marks and Spencer's and spending hundreds and hundreds of pounds on skincare. I think she said at one point the whole set was £400. But her skin was red, inflamed. She had sensitivity and redness on her chest that was quite sore. And she actually was not really looking at having facial treatments. But we discussed skincare. I explained again why the skincare isn't working and why it's not resolving the redness and sensitivity. And we gave her it was a skincare kit, and she went away with about 7 products. Came to see me after 6 weeks for a review. I think this was her second or third review, so it's probably 18 weeks. And we put these 2 photos together, and you can see here she's significantly reduced the redness and broken capillaries here. Her skin's healthy, nourished, has plumped out the fine lines and wrinkles. She would have been using high strength vitamin A as well. She was using a pigment inhibitor. She just basically transformed her whole entire skin. And it was another client who said she felt confident now to go without makeup. What a lot of our clients tend to do is use a tinted sun shield, which is an SPF 50, and that kind of hides any minor imperfections. So a lot of clients do feel quite comfortable just going out during the day with this tinted sunscreen on, and obviously putting it like a little bit of makeup, lashes, mascara, a bit of lip balm or lipstick. So we've got quite a few clients that actually do that. And then here on the right, we've got a lovely client who came in. She doesn't actually use skincare with us, but this was her before and after results of having a course of collagen facials. And our collagen facial treatments, they have a course of 6, taken either twice a week or just once a week for 6 weeks. So twice a week for 3 weeks. And then we tend to get a really good result with those. We get a reduction in any excess fatty deposits that tend to happen around the jawline, the chin and the neck, which we can see here. It kind of melts any excess fatty tissue. After the treatment, it tightens and contracts existing collagen and elastin fibres, which helps to give an overall lift to the skin. It rejuvenates the skin because we're stimulating a lot of blood circulation, which is going to feed the upper layers of our skin. So the skin gets huge nutrition, which gives a really nice radiant complexion. And obviously you can see here we've significantly plumped and firmed the crepey skin, fine lines and wrinkles. And that's after having 2 sessions a week. So she would have had 3 over a period of 3 weeks. We got this lovely result, which she now maintains every month for a top up. So just going through our method and how we are able to achieve those kind of results is the first thing we do is obviously look at how the skin's functioning, and understanding what's going wrong, and then we look at fixing it. So how we do that is if we are aged, or if we're young, or we've got acne, like for example with me, we had to use medical grade skincare to resolve the acne, but the other benefit to that was that we introduced vitamin A, so it increased my collagen, elastin, hyaluronic acid, which gave me a healthier, more youthful looking skin. If it's pigmentation, we would be looking at adding pigment inhibitors into a skincare plan. But the essential thing is that we would get the skin cells functioning better, and we would get these fibroblast cells working at a high capacity. And we do that with the medical grade skincare. So that's the first step, is to assess what's happening and decide on what we're going to target. The second thing is to use specific products in the morning and in the evening to make sure that we're nourishing the skin and we're repairing any damage. After we've done that, we then look at adding in treatments. Sometimes, obviously, if somebody doesn't want to go for skincare, and they literally just want to come for a treatment, it's absolutely fine. But you can see that if we don't repair the damage, if we don't stimulate these skin cells to produce more collagen at home every day, and the skin's tired and it's not functioning well, and we skip straight to 3, which is having treatments, the quality of these treatments is going to be determined by how well our skin is functioning when we're having these treatments. So this is why, in an ideal world, everybody would repair their skin through specific medical grade skincare at home every day. Some people do this and they actually don't have any treatments, but if clients are wanting a full transformation, we would be advising them to repair and stimulate their skin at home. And then obviously the results of the treatment are going to be much more, they're going to get better results. And this is what, allows us to achieve the results that we do. So if you are already investing in premium skincare, but you're not seeing the results that you want, and you have skin conditions like you may have redness and sensitivity, you might have rosacea, you might have adult acne, or you might be younger and be suffering with breakouts regularly, you might have pigmentation and dark spots that you can see. All of these types of skin concerns really are only going to be corrected when we're using the right type of products in the right way. So rather than advising anybody to go off and use products that don't work, we always recommend having a personalised skincare plan. It's a direct route to achieving what you want to. If you are treating aging as well and you wanted to add in some anti-aging skincare treatments, again, we're going to suggest that you need to create more collagen, elastin, hyaluronic acid, and you can do this every day at home. Once you've done that, you're then going to be able to beneficial results from any microneedling or collagen stimulating treatments that you might want to invest in. A course of collagen facials, for example, radio frequency skin tightening, all of these things are going to work 100 times better when your skin's actually functioning better. This is why if we're treating a younger client whose skin cell function is going to be quite high and fast, the cells turnover cycle is going to be quicker, they're obviously going to see better results from any treatments because everything's working that much quicker. And then in a more mature, sluggish, skin function, it's going to take a little bit longer. But actually, whether you're 35 or 65, these products and the treatments that we do work for everybody. And we've seen some amazing results from clients who have only just started using medical skincare after the age of 50, and they've still been able to stimulate enough collagen to plump out lines and wrinkles and create healthier looking skin. So we know it works. We prefer a personalised plan. Book a consultation over the phone or via FaceTime. We would send out a consultation form in advance. We then put a product plan together, and these start from, with the Zeo Skin Health, I actually do some really good skincare kits, which are smaller sizes. So this has allowed our clients, rather than investing in full size items, they're able to have 5 to 7 products, travel sizes, from as little as £195 for a kit, which lasts approximately 3 months. Some of the products will last a bit longer. So it's a really good way to invest in a full skincare plan. Like I say, even after a couple of weeks of feeding and nourishing the skin and treating it correctly, clients notice a visible improvement in the condition of the skin quite quickly. So that's what we advise people do. I'm going to include a link in the description which will take you direct to my WhatsApp. So you're welcome to message me and schedule in a consultation. You'd have a product plan, an AM and PM routine, and a PDF guide. Instruct you on exactly how to use it and give you some tips on what to do for the first couple of weeks. And how to incorporate everything in, especially if we're including some actives at the beginning of your skincare plan. Also, at the moment, because it's Black Friday, we do have 15% off Zeo Skincare. This is a system that I use personally and professionally, and it works really well when it's used correctly. So for a limited time, we're able to offer 15% off. You can message me on WhatsApp to get started. So we've just got a couple of really nice messages from some of our clients who have sent us an update on WhatsApp. So, and I remember when I first started using my skincare, in the morning when you're getting ready, and the last thing you want to do first thing in the morning whilst trying to get yourself ready is piling on lots of makeup. I remember trying to cover spots, definitely couldn't go out because I've got this pigmentation and blemishes and didn't want anybody to see the condition of my skin. So I think it does make such a difference to not have to worry about that. Not that it's a big worry, but the fact that you can just get up, do your routine, your skin looks amazing. It gives a really nice base for then any makeup that you do want to apply. But like I say, a lot of clients tend to generally just use a tinted sun shield. I only use that now. I actually use a bronzing powder, which is by Zeo Skin Health as well. So it acts like makeup, but actually it's skincare. So I very rarely put any makeup on my skin. The skincare, because it's tinted, and the bronzing powder's tinted, that's enough to give me a healthy glow, obviously with the condition of my skin underneath being healthy with all of the skincare. So it's just lovely to have these messages from our clients. So again, I'll include the link to WhatsApp in the description. And we've also got a little gift. So if you've enjoyed this masterclass and you want to dive a little bit deeper into how we correct particular skin conditions like pigmentation, acne, rosacea and sensitivity, in this PDF guide, Correct Don't Cover, it's really looking at how to achieve flawless skin and how that actually, to achieve flawless skin, you have to have healthy skin function. It's a PDF guide and it comes with some video training, and so we'll also include the link in the description. Thank you for listening and hopefully see you soon.